behalf of the College of Social Science and Michigan State University, I want to welcome you back to our first policy forum this fall. My name is Corwin Smith, and I have the pleasure of serving as interim director of IPPSR this year, while Matt Grossman is on leave for a Carnegie Fellowship, and I am excited to be here and learn about the RxKids program. I'm here with IPPSR. You may be familiar with IPPSR, and IPPSR does a big help. The people who are here, who work for IPPSR, you may be more familiar with. They do a big help and have helped sort of run this program. Arnold Weinfeld, the associate director, is in the back. I'm just going to hand Tony Zamet, communications manager, thank you both. The Institute for Public Policy and Social Research, or IPPSR, works to bridge the gap between academic experts and the people who make our laws, bringing research to life to solve the big challenges facing our society. We do it in multiple ways. We talk about issues and conduct research on studies on the important public policy topics of this day. We look to offer survey expertise for those who want to study local communities or communities in Michigan. We educate and train. We develop programs to educate and train future leaders, such as the Legislative Leadership Program, MPLP, Legislative Staff Training Program, and the Legislative Exchange Program, or MILE, which we've been starting this year. These are all great programs, and you should look into more of them. They're great. And we also are seeking to spark important conversations. We create opportunities for diverse groups of people to discuss society's most pressing needs. And that's why we're here today for our forum. Our forum are one of those ways we seek to connect research experts and academic innovators at MSU with the broader policymaking community. It is unfortunate, but a rare sight in government today that a forum like this is not too common, focused on information, not advocacy, and provides civil discourse concerning how to improve the state of Michigan. I had the great opportunity of presenting back here in 2018 on the not so controversial topic of redistricting. And what I loved about that was I got asked by multiple people to be put on retainer afterwards, which if you know me, you do not want me on retainer. I can't keep my mouth shut. But what it does speak to is the importance and the role that a forum like this plays in terms of providing information to the capital and the policymaking community and how that works. We have a couple brief announcements. One, I mentioned the Michigan Political Leadership Program. MPLP is a bipartisan potential candidate training and learning program that seeks to select a diverse group of 24 individuals for a 10-month training program. Applications for that program are now open. They are due Friday, September 26th. It is a 10-month program starting in the winter and then extending all through November. I think November, the first week of November is the last one. It's a great experience for those. We've had staffers, a lot of people go on to do amazing things. The program is currently co-directed by Rudy Hobbs and Tanya Scheidmaker. So I would encourage you to apply or recommend that program to people who are interested in running. And briefly, Arnold will have some info. We do have an October forum scheduled on ARPA funds and the spend down in federal government spending in ARPA funds for K-12 schools and local government. And we have planned to have that on October 7th. But today's topic is RxKids. RxKids is a first in the nation unique collaboration between the state of Michigan, MDHS, HSS, academics, health systems, communities, and nonprofit organizations. Many of you may be familiar with the general concept or idea of RxKids, which is providing cash transfers to pregnant and new mothers for about 6 to 12 months across different communities. And it's based on the idea that these funds greatly improve child and household health and outcomes. Now, this program started, is it January 2024? And has now been introduced in the cities of Flint, Kalamazoo, Eastern UP, Pontiac, Clare County, Royal Oak Township, and Hazel Park. And there's more to come. All right. Now, there's a lot of things one could discuss with this program. There's research nationwide on how cash transfers can benefit families. As a data person, I heavily recommend the website. It's great in terms of providing updated information on those dashboards. I love a dashboard. Love a dashboard. But we're going to focus on here the idea about how programs should, we could talk a lot about how programs should work and if they're effective, but oftentimes when we talk about policy, the translation of how a policy should work and how it actually is implemented is a big difference. So we're focusing here on hearing about how RxKids has worked so far in its operation and its impact in its very early stages. So we have two people to hear from today. On my left, your right, let me get over there, is Dr. Hanna, and I have the Associate Dean for Public Health and C.S. Mott Endowed Professor of Public Health at Michigan State University College of Human Medicine. She is the founding director of the Pediatric Public Health Initiative, an innovative partnership of MSU and Hurley Children's Hospital in Flint, Michigan. She is re-imaging how society can come together to eliminate infant poverty as the director of the first in the nation program, RxKids, which we are discussing today. You may know a lot about Dr. Mona, but I have just recently been involved in a project with her, and it's been a lot of fun. And I got to meet her for the first time in real IRL, first time today.
And he's a lot taller than I expected. Yeah. And I was a lot shorter than he is.
But it's been great. It's been named Time Magazine's most influential people in the world and recognized U.S. Today's Woman of the Century for her role in uncovering the Flint water crisis and leading recovery efforts. And on my right, we have Alyssa Stewart, currently who's serving as Chief Community Impact Officer at the Kalamazoo Community Foundation in its 100th year, mobilizing people, resources, and expertise to advance racial, social, and economic justice in Kalamazoo County. In this role, Alyssa has led the expansion of KZCF. I need to get that acronym. I'm good at the MSU acronyms. I need to get the other ones. Community Impact Priorities, and provided leadership to innovative community projects, including leading local fundraising efforts to launch RxKids in the city of Kalamazoo in February 2025. Alyssa has 15 years of social service and philanthropic leadership experience, which began in directing workforce development at the W. Upjohn Institute, and which in services in providing career development services to adults receiving TANF, temporary assistance from needy families, funding assistance from the state of Michigan. She has served as a decade on many boards, and she holds a BA in Political Science Public Policy for Albion College, I like the MIAA love, as a Calvin alum, and a Master's of Public Administration from Western Michigan University. So we got a lot of representatives here. Alyssa is here to share her observation on how RxKids has so far worked in Kalamazoo and where she's seen an impact on how those obstacles and where there might be sort of ways to grow as well. Now we were discussing, we'll have Dr. Mona and Alyssa give us some I don't know if you want to do some introductory comments, and I have some questions. There's a lot of things, as I mentioned, there's a lot of things we could talk about. So we're going to focus some topics on sort of a range of questions relating to the implementation of the policy. Did you want to speak, or do you want to go straight?
Let's go to the questions.
Let's go to the questions. All right. So one thing I was interested in just hearing about was what are some of the specific goals, milestones of the program in this first year with RxKids? And it's been, well, now it's more than the first year. It's been a couple of years. And how has RxKids done on these in terms of implementation? So there was the idea. I think some people are very familiar with the idea. But how's that seen in terms of implementation and how that program's worked, including how it's worked with partnerships?
Well, thank you. Thank you for this opportunity to be here with all of you. Thank you, Corey and IPPSR and Alyssa, and all of you for taking time to learn about RxKids. So RxKids is pure joy. Who's heard of RxKids? A great number of folks. So like Corey said, it is a mom-baby cash prescription program. That really kind of centers around this concept that it is really expensive to have a baby. The mom-baby window of life is actually the poorest window in your entire life course. There's a perfect storm that happens where income drops and expenses rise. And couple that with being in a nation, only one of 7 countries in the world that doesn't have paid parental leave. So that makes it a really kind of economically vulnerable time. And on top of that, as a pediatrician, this is a window of life that is the most critical when it comes to child development. We have learned so much about early childhood, but what happens in this window really shapes your entire life course. Your brain literally doubles in size in the first year of life. So RxKids is this sort of simple idea that we should support moms and families during this really critical window with direct cash. It is efficient, it's done across the world. It's been done here in the US at different levels of scale. And it is in some ways this kind of root cause social determinant of health. For so long as a pediatrician in Flint, which is the poorest city in our state, I have wished for the ability to prescribe away poverty. So much of what I do is treating the consequences of poverty, be it a missed appointment or developmental delay or chronic disease or weight issues. The list goes on and on. So this is, RxKids was really kind of born out of the idea that we could be like other countries. 70% of countries in the world do some sort of child cash transfers, but that we could do something in this really time-limited way, this mom-baby period, to prevent poverty. For the main goal of this program is to improve health. That's why it's called RxKids. I see it as literally a prescription for health, hope, and opportunity. So the main goal that you asked, the main goal is improving health. So we have lots of measures of how are we improving health, and how are we improving health, not just for individuals, but really at a population level. RxKids is not a program for, per se, individuals. It's a program for entire communities. It's a place-based effort. We started in the city of Flint, and it's for everybody in the city of Flint. It's for every single pregnant mama, every baby in the city of Flint, and because it's because living in a poor place has this kind of compounded adversity that make it really hard to be healthy and successful. Lack of grocery stores, unsafe places to play, poor schools, environmental issues, of just kind of your zip code that makes it hard to be healthy and successful. So we knew that we wanted to do something for a place. We knew that we wanted to target this brief window of life, this maternal infant period, but we didn't really know how to do it. So I can tell, I know what kids need as a pediatrician, but I do not know how to get people cash. Like that was like, when we first kind of conceived this idea, we're like, well, how am I gonna do this? Like how are we gonna get people cash and without reinventing wheels? And the neat thing was that MSU at that time had a big idea proposal. In our medical schools, it was a sustainable health proposal. They're like, submit your big idea. If you could solve a big problem out there, like to improve health, like what would you do? I'm like, oh my gosh, like I'm finally gonna write out that I wanna solve poverty, because to me, that's what it means to be part of a university. Universities solve big problems. We engage scientists and community and work together to solve big problems. Like I wanna solve poverty. So we submitted a proposal, like I want to do universal child allowances for starting in Flint. I want to improve health by solving this big problem. And you know what? That grant got rejected. And the reviews were hilarious. It was like, good idea, but not feasible. They're like, you can't do this. You would need to raise too much money. And so if anybody knows me, like, no is what drives me. And I'm like, I'm doing this. And so then we submitted actually another grant to the NIH, which also got rejected. And that was also kind of further fuel to figure out how to do this, because it hadn't been done before at scale. So that's where the implementation kind of came into play. How are we going to do this for an entire city? We need to raise a lot of money. And we knew that we could probably be more effective if we did something as a public-private partnership. So our first funder for RxKids was actually the C.S. Mott Foundation, which is based in Flint. And for so long, that foundation, and really kind of foundations across the country and the world, have been reactively spending money. Spending money, just as we do in medicine, kind of band-aiding the consequences of not doing prevention. So they really thought that this was a smart idea, that it could address so many other problems, that they wouldn't have to spend money later on mental health, on transportation issues, housing stability, the list goes on. And they amazingly committed $15 million to RxKids in Flint. But there was a catch. It was a challenge grant, which meant that we could not unlock that money without raising another $15 million. So that then made us very busy seeking other funding, and have enabled us to work very closely with the state of Michigan to unlock TANF dollars. Corey, I don't know if you want me to get into that kind of public-private partnership?
You can if you want.
Okay, so is anybody familiar with TANF? So in 1996, President Clinton said, we're going to end welfare as we know it. And he did. He transformed the former cash welfare program known as AFDC into TANF, which stands for Temporary Assistance for Needy Families. No longer was it a federal program, but it became a state block grant. So every state gets millions of dollars, with the intent of providing support to poor families, temporary assistance for needy families. So in 1996, this became a state block grant. Michigan gets over $700 million a year from the federal government that they're supposed to spend on cash assistance helping poor families. However, Michigan and most states don't do that. They spend money on other things. It's become a flexible funding stream and a budget filler, as long as they can fulfill these other clauses of TANF, which include things like promoting marriage, preventing unwed children, and supporting other programs. So in Michigan, before RxKids, only 7% of TANF dollars was actually going to cash assistance to poor families. And this is throughout the country. You may recall there was a scandal in Mississippi with Brett Favre where they used TANF dollars to build volleyball courts. Not okay. So we presented in 2024 a different vision to the state, like, hey, this is money that is supposed to be spent for cash assistance for poor families. What if instead of reacting to problems, we use part of these funds to support mamas and babies in this science-based, prevention-driven, child-centric way? Let's try to figure this out, figure out a different way to use these funds that are consistent with its intended purpose. The state agreed. It was included in the state budget in the fiscal year 2024 as pilot funds to Flint for a portion of the money that was needed. And we are using this provision in TANF, which is super wonky, but you guys are policy people, called NRSTs, non-recurring short-term benefits, which allow you to give 4 months of cash during an acute episode of need. And we pitched to the state and to the federal government that childbirth is an acute episode of need. Remember I told you this is the poorest time in people's lives, the poorest time. And they agreed. So we can use 4 months of TANF for these cash prescriptions. And then we sprinkle in philanthropy and other dollars to make this a universal program in poor communities that extends for either 6 months or 12 months. So what RxKids is now, it is every pregnant mama in an RxKids community gets $1,500 in mid-pregnancy. And then once a baby's born, it's $500 a month for either 6 months or 12 months. Like Corey said, we started in the city of Flint, we figured it out, we built it, it worked. And then in fiscal year 2025, additional TANF dollars were included in the state budget to expand this to other low-income communities in Michigan. We quickly expanded, thanks to Alyssa's leadership, to the city of Kalamazoo in 2025, to 5 counties in the eastern UP. Rural poverty has these additional challenges. Chippewa, Mackinac, Luce, Schoolcraft, and Alger in the UP. We then expanded to the city of Pontiac, Clare County, mid-Michigan, rural poor. This last week, we expanded to the city of Hazel Park and Royal Oak Township. And we'll soon be expanding to several communities in Lake County. So it is plug and play, it's ready to go, we can't wait to continue sharing this program with other communities in the state.
So, Alyssa, you were part of introducing it in Kalamazoo. I don't know if you would, what parts you would like to emphasize, but how have you seen it how was that effort how hard was it to get the community united? And how has that transcribed in terms now that it's in place? What are you seeing as things are going as it started?
Absolutely. So yeah, we in Kalamazoo are grateful to have been the first expansion site after its inception place in Flint. And for a little bit of context, for those who don't know, the city of Kalamazoo is home to about 72,000 people. And like many counties, it's sort of the urban seat, and we have a concentration of poverty. And it's also the most diverse, racially diverse part of our county. And we have in our community struggled, as many communities have, with infant mortality, with babies being born and then dying before their first birthday. And we have significant racial disparities in our infant mortality rate. So this period of life, pregnancy and the first year of life, have long been a focus for our community. We have efforts like a collaborative called Cradle Kalamazoo that for over a decade have been working to address the causes of these racial disparities in our infant mortality rates. So I share that for a sense of context about our community's size and some of the issues that we have been grappling with. So when we became aware that partners, just over to the east of us were designing and launching this program, the stars felt aligned. We had been trying to find solutions to this problem. We have done many of the things that are probably happening in your communities. We've implemented expanded home visitation programs, doula services, programs to try to get people into earlier medical care and reduce barriers to medical care. We've done a lot of those things, but we were still struggling with that core problem of a lack of financial resources. And we were seeing families having to go to 10 different programs to have their basic needs met. The food pantry here, right? Their WIC supplies here, go here for a car seat, go here, right? As they were in this high stress, vulnerable time, they were being forced to run a gauntlet to get the basic supports they needed, and it just was not efficient, and families were falling through the cracks, and for us in our community, that was unacceptable. So as soon as we identified this was happening, we called Dr. Mona and basically said, we heard you're doing this thing, can we do it too? Can we be in our RxKids community? And we were able to immediately start having conversation because it is such a plug and play program, and the goal has always been to have it be place-based, but not limited to one place, to be able to be expanded across the state and across the country. We were able to pretty quickly move into planning in earnest for this. So for us in Kalamazoo, what we did to start to build community will and buy-in was pull together stakeholders. So we pulled together our medical systems, those home visitors, advocates and champions in the maternal and infant health space, and expose them to the program. We shared, this is what the model is, this is the ethos behind it, this is how it's going so far in Flint. We think we could be the next pilot site, and we should do that. And resoundingly, the feedback we got from those stakeholders was yes, was we believe that our community needs this, and that this is an opportunity for us to be a part, to really be on the cutting edge of something, to be on the cutting edge of being part of groundbreaking research on the outcomes of a program like this. And so there was a lot of excitement about that, and really, more than anything, excitement for how this would impact the families. The relief that this would create, the support that this would create, the feeling of care that this would provide to families and babies in our community was really the most powerful piece for many of the stakeholders. So we started to move forward and began fundraising. That philanthropic and public dollar mix is really important because the philanthropic dollars allow for this to be a non-taxable gift to recipients. So that is critical because that means that it does not have to be claimed on their taxes as taxable income, and it avoids any benefit cliff implications where this income puts them over the edge and they lose maybe SNAP benefits, food benefits, or childcare subsidies from MPHHS, right? So it protects those benefits, which is critical because we don't want them receiving the $7,500 to actually result in them losing $20,000 worth of childcare subsidies and food supports. So this benefit can be layered on top of those other critical benefits. So we have a wonderful philanthropic community in Kalamazoo, like many communities do, and we were able to, again, I don't want to say easily, but somewhat easily. Everyone loves babies. Everyone cares about families and wants healthy families. And so we were able to pretty quickly pull together a coalition of funders. Critical for us was our municipalities. I know the forum coming up in October is about ARPA dollars. Many of our municipalities had ARPA dollars still remaining that needed to be spent. Some provided ARPA dollars to support year one. Some provided general fund dollars, but we had significant support, $2.5 million contributed by our city and our county government. So that was a huge win. We had one of our largest foundations, the Stryker Johnson Foundation, contribute $5 million, and then we were sort of off to the races. So we were able to, within a 6-month period, raise $10 million in philanthropic funds. Which was incredible. And to be honest, one of the largest scale collaborations of our funders, it's not common that funders can all rally around something. But again, this issue, this population is of such utmost importance to so many of us that it really was a rallying point for how we could collaborate differently. I mentioned the $5 million gifts. We also had some foundations give $5,000 or $10,000. It really was an all call. Every dollar was welcome. And so yeah, so we expanded, or we launched in February of 2025, and it has been well received. That pulling together of stakeholders meant that everyone was bought in. And so as soon as we launched, it was everyone helping us get the word out. And we're excited to share that in the first 7 months, we've already hit 88% uptake. So what that means is for every baby born to residents of the city of Kalamazoo, 88% of those have been enrolled in the program, which to get 88% uptake in anything, right, especially for this population, which can often be hard to reach, is enormous, and it's going to continue to grow, right? Our goal is to get up to 100% of folks enrolled because it is universal, it is for everyone, and we've also found that to be a critical facet of the program. The universality is elegant, simple, efficient, but it also eliminates stigma. The most challenging part of traditional models of welfare is that they were built on some level to stigmatize. It was shameful to receive these benefits, and RxKids really turns that on its head. It is for everyone, and it is, again, because of the simple fact that regardless of your income, having a baby is expensive, and everyone can use support in that window of life. So we've definitely had questions. We've had stakeholders with questions or ideas, people who are really wanting to ensure that this does get to every population it needs to get to. But in general, this has been a very positively received program on the ground, and families have embraced it. One other piece I do think is important to just touch on is the application process for this through the administrative partner, which is Give Directly. They're a global leader in the provision of cash. The whole process is online. They don't have to go into an office, find transportation there, lay out their paperwork on a desk and have someone else look at it, right? Again, speaking to how traditional systems have worked. They can enroll themselves as soon as they have medical proof of pregnancy and fall within the window of eligibility. They can get on their smartphone, their tablet, computer, fill out an application. It's available in multiple languages. It's accessible for people with speech impairments, with vision impairments, and they can be enrolled within 15 to 20 minutes. And they will begin getting their cash via direct deposit or a prepaid debit card, whichever they prefer. So it is low barrier, accessible, and that again reinforces that lack of stigma that I think has been really critical to that high uptake rate.
I think Alyssa touched on a lot of things that make this program super efficient. It's universal, so there's no bureaucracy behind this program trying to figure out like who's in, who's out. Is it for this much income or first baby or this good? So it's because of the universality, it's super, super efficient. And then it's also unconditional. There's no strings attached, which means there's not another bunch of staff figuring out, like policing people on what they're spending their money on. And this kind of really reiterates kind of, the first champions of cash transfers were, Milton Friedman, libertarian conservatives, because of its efficiency. This is not something that's growing government. This is something that's super small. We just launched 3 communities in the last month with no new staff hired. It's all, once again, mobile-friendly, seamless delivery of the program, yet having a profound impact in people's lives.
We'll have about, in 10 minutes, we'll have time for questions from you all. So I just want to hit a couple things there, because you've talked about some of the questions I had before. But one, you talked about being plug and play, but it also seems like what Alyssa said with the philanthropic dollars does make a difference. Now you're expanding. It sounds like there's not much staff impact on government, but what kind of stakeholders are involved in the process? I see there's an application process online. How does a community, what's the ramp up speed for communities in terms of getting this program implemented?
Yeah, so the program is led by MSU. We have a partner at the University of Michigan. There's an institute called Poverty Solutions. But all the hard work is done by the entity that Alyssa mentioned. It's a nonprofit called Give Directly. And they are the international leader in cash transfers. We did not want to reinvent the wheel. We wanted to go with the best in class. This is all they do is cash transfers, and they run most of the nation's cash transfer programs. So folks enroll online. It's RxKids.org. It's super easy. It's in multiple languages. It's been mama tested. Our mamas helped us devise this application process. It takes 10 to 20 minutes. And then there's a verification process that the folks at Give Directly do. Is this really somebody who lives in this community? Is it really a pregnant person? We actually found out about a company called Baby Maybe, where you can make fake ultrasounds. So they're fantastic at fraud detection, which is tiny. And then once they realize it's really a person who's really pregnant, who really lives in this community, they verify once again the residency, identity, pregnancy, childbirth, then the folks get their cash very seamlessly delivered, and by and large, it's done by a direct transfer to a checking account. So that is like the entire program administration. So, you know, where we have gone has been based on need. We only, as of now, go to 4 places. High-need communities where there's significant issues with hardship, maternal infant health issues. But because it's a public-private partnership, we are also driven to go to places where we can get that philanthropic match or the municipal match to make it possible. Kalamazoo champions. Alyssa is amazing. Her team is amazing. The day after the budget passed last year is, I think, when the Stryker Foundation said we're in for $5 billion. That's amazing. Like an incredible community. Several of the other communities with this high need, they don't have as many philanthropic partners, but they still have high need. We knew we wanted to get to the Upper Peninsula. The Eastern UP is the poorest part of the UP. There's no birthing hospitals. Like, it's so hard for people to get care. They have to drive a long time. They don't have as many social services and safety net organizations, nonprofits in those rural communities, and not as many foundations. But we knew it was important there. So we raised actually $4 million from foundations outside of Michigan to be able to launch in the Eastern UP because it was so important to have a proof point that this is possible and works in a rural community. Pontiac was kind of high on our list, but not super high on our list. Lots of need in Pontiac, and then out of nowhere, a family foundation gave $3.5 million to match the state dollars, and then we were able to launch in Pontiac literally in months. So if there is a match, if there's a willing partner or an anchor funder or a whole kind of family of funders, we're able to launch. Our goal is that in the future, there's not as much of a philanthropic lift, that it becomes more and more of a public program, but always having those other partners. Alyssa mentioned this really important provision that will where if there's $1 of philanthropy in every cash transfer, it protects those other public benefits. That's really important, and that means it will always be a public-private partnership. So we're hoping that we can leverage more public dollars to make it more sustainable, so that we can once again expand literally within months. We are working with so many other states right now who want to bring in RxKids. The state of Mississippi declared a public health crisis because of their high rates of infant mortality. They asked me to testify before their legislature in a couple months to see how RxKids could be a solution, a rapid solution to their crisis, as well as many other states who want to use a different combination of funds to do that.
Awesome. So I'd just like to know if there's anything that's been learned. So some of this is research-based. I mean, I know there's sort of a lot of talk about cash transfers nationally. This seems different than just cash transfers. Because it does seem like, Alyssa referred to the stigmatizing event. This does seem like there's a lot of messaging that goes on with this as well. I don't know and then basically also just what are the questions that we're looking for in terms of research studies, or what reports maybe we might be looking from coming out in terms of initial, what are we interested in first in terms of the effects of RxKids?
Corey, that's a great question. So I'm an academic, so I work for a university, so we do research. We love data, I love dashboards. When you said dashboards, I got excited. In some ways, we don't even have to do any research. Child cash transfers are done around the world. 70% of countries have child cash transfers. I was born in the UK, and my mom got money for me every month, I think week. She got a few pounds every week. It's been around for about a century in the UK and around the world. But we are academics, and we love to do science. I will also say that we also learned a lot as a nation in 2021. So during the terribleness of COVID, we did something that also made us, like other peer countries, we expanded the child tax credit. So millions of children, millions of families got monthly unconditional cash allowances. We dropped child poverty to its lowest level ever in the US, and with that was a massive improvement of lots of other health, mental health, housing stability, decrease of abuse and neglect. The list went on and on, all these amazing benefits from the expanded child tax credit. That was not renewed by the US Senate by one vote. Millions of kids went back into poverty and all those outcomes reversed. So that was a bit of the inspiration for RxKids to continue doing this really important work of supporting kids and families at a critical moment in life at a scale that hasn't been done before. Once again, this is the first community-wide program of this kind. We are running the largest cash transfer program right now in the country, and it's happening here in Michigan. Woo! Yes, it's amazing. What we have learned, the first thing is what Alyssa mentioned, we have learned that we have a super high take-up rate, which is outstanding. In all of our communities right now, our take-up rate is at 98%, and we are able to validate that because we look at birth certificate data. This is shocking. Other programs in this window of life, like WIC, really important mom-baby nutrition program, has a 50% take-up rate. 50% of moms who are eligible for WIC sign up for WIC. Home visiting programs, also really important, have a 20 to 30% take-up rate. So we have achieved a near universal take-up rate with very little marketing. People find out about this because it's popular. They think it's a scam at first. They hear from friends and family, they hear from social media. They sign up, it's easy to sign up, the eligibility is clear. So that's the first data point, and we actually have a publication about that on this amazing high take-up rate. The other things that we are learning is that people are spending their money on number one, baby supplies. And when you break out baby supplies, it's diapers. Diapers is the number one thing that people are spending their money on. Then, just like other child cash transfer research, they are spending this money on food, rent, utilities. That's what these dollars are going for. We are also seeing, we have a paper coming out later this week in the American Journal of Public Health that talks about the impact on family financial stability. We have improvements in housing security. This is one of the most housing unstable times of life. 30% of pregnant people are housing unstable. Up to 9% of folks are homeless because it's an economic shock. We in Flint had massively decreased evictions. We had 0 evictions in low-income families that were surveyed last year. That's amazing. Families had less back-owed rent. We had improved nutrition security, improved diaper hardship, which is a thing. So we have significant improvements in family financial security, which is leading to improvements in maternal mental health, decrease in postpartum depression, decrease in parental stress. Families can say they can breathe. A weight has been lifted off their shoulder. They don't have to choose between food and rent. They can stay home maybe a little longer with their baby. Their spouse can stay home maybe a little bit. Or they can pay for childcare. So massive reductions in maternal stress and maternal anxiety. We have a paper that is coming out next week on birth outcomes. And this is just really, really incredible data that's coming out. And it's population level data, which we are able to use from birth certificate data because we have such a high take-up rate. We are seeing a decrease in premature babies. We are seeing improvements in birth weight, and we are seeing a prevention of NICU admissions, babies in the neonatal ICU. These are things that have been really hard to move. There's not much evidence on things that improve these things at a population level. And within months of starting RxKids, you can see all those rates begin to decline, which is amazing, and I'll talk about how just those measures have impact on cost savings for the state. We are also seeing improvements in child welfare. So child welfare is the involvement in the protective services system. The peak age of involvement in the child welfare system is the first year of life. More than double any other age, and largely that's due to poverty-related neglect. So families don't have enough resources, they can't keep the heat on, the kid looks dirty, what have you, investigation is filed, they may lose custody of their children, and we as a society pay for foster care for the next 18 years, okay? So this is preventing almost a 25% decrease in child welfare allegations. That is a game changer for families, but also for the state budget. So all of these things are, often in my world of pediatrics, when we talk about kids, it's often about like societal savings. Oh, they're gonna do better in school years from now. They're gonna have less chronic diseases. They're gonna have increased economic productivity. Yes, we will have those long-term benefits, but we are already seeing the proximal outcomes, that are happening because of this intervention at a population scale. So lifting up entire communities in these intransigent measures that once again have been very hard to move otherwise. I think it's time to ask for to have a conversation. And all of this is laid out in the packet that you guys have.
I don't know if there's anybody with their hand that'd like to ask a question. If Here, I'm right here.
Absolutely. Hi, Emily Brewer. I am the Associate Superintendent for Ingham Intermediate School District. I work in all things early childhood. That's my department. This sings to me. Our first outcome statewide for our Great Start Collaboratives is our children are born healthy. I'm also the mother of 3, and boy, would this have helped me.
Every parent can relate.
Oh my gosh.
Even the pediatricians. It's
Yeah.
so hard. It's so hard,
Yeah.
baby.
The stigma decrease, amazing. So my question is, what thoughts do you have on 1, sustainability, and 2, how we can rally and bring this to our community?
So let me talk a little bit about the stigma. So, and Alyssa mentioned this too. So this program is absolutely about eliminating poverty amongst babies, and we're doing it. We are eliminating deep infant poverty. We are improving families' financial security. We are improving health at a population level. But we're also sending a different message, right? We're telling families that we see you and we hear you, and we know how hard it is to have a baby, and that as cheesy as it sounds, we love you. So our logo has a heart. I only wear red now. Every baby in an RxKids community gets a onesie mailed to them that says love on this. But it's fundamentally about restoring that social contract, that relationship that individuals have with institutions, be it healthcare or government or academia or philanthropy. So that's also very deliberate in our design, is these values. We're telling families we trust you. We trust you to know what's best, and this is about agency and empowerment. So a little bit also about the design, the messaging that's part of this program. Every community has a baby parade. Baby parades were common a century ago. We've brought back baby parades because we are changing that narrative. We are celebrating our moms and our families and our communities, rather than often what we do, which is vilify and stigmatize them. Okay, but let me get to your questions. You asked about sustainability. So we have been able to leverage TANF dollars. That is amazing. Nobody else has ever done that in the country. And that is one sustainable pathway. We have been able to unlock, this federal funding stream. So we hope to continue doing that. But we hope to have other sustainable pathways. One of the reasons it's called RxKids, prescription, because I want healthcare dollars. Like, we spend the most money in this country on healthcare than any other country in the world. We spend the most, and it is a reactive, sickness-based system. I want those dollars to be spent on prevention. So we've been in conversations with CMS and Medicaid and how we can bring in some more healthcare dollars. So I see that as one potential pathway. More public dollars, be it not TANF dollars, be it general fund dollars. Other communities have talked about millages or other municipal dollars that can support this. So right now, philanthropy has a heavy lift, but I tell our philanthropic partners that I see them as the doula of this program. Like, they're helping birth it, like bring it to life as a kind of proof point. But our goal is for this to be a larger public program. We were also very involved in national conversations. Recently, President Trump was talking about a $5,000 baby bonus to help families with the affordability of this era. Vice President Harris, one of her most popular proposals in her campaign was a $6,000 newborn credit, which was inspired by RxKids. So in a very bipartisan way, because everybody loves babies, we also hope to advance this and make this more sustainable.
The one thing I would add to your piece about how to explore for your community is just to lift up that the RxKids team has developed a really amazing toolkit, which is available on the rxkids.org website. It's interactive. It actually allows you to put in the number of births that your community has per year. It actually will provide you with a calculation of how much you would need to raise to be able to launch this program. So because it is scaled in so many places, they created really great tools to aid a community's exploration of what it would cost, what it would look like in your community. So I just wanted to make a plug for that toolkit.
And it's been shocking that we've raised $100 million in the last couple of years. Like, it's amazing, but like foundations and policymakers it's like in a dull moment. Like, oh my God, this is so foundational. This is so intersectional. Like, we don't have to spend money on housing insecurity. Like, it addresses so many of the poly crises that we're facing right now. The unaffordability of childcare, how hard it is to afford rent and a place to live, the price of eggs. Like, the list goes on and on of what this kind of foundational thing is able to address. It's a bit of a panacea.
Hello, I'm Andrea Robinson, and I want to thank you both for implementing this and bringing this to your communities. We would love to have it in our communities. Actually, we're in Wayne County, so we would love to have that in our community. So I have 3 quick questions. So one, I'm talking about the data here. So I know if you're dispersed funds, you either get it through a debit card or direct deposit. So how are you able to track what the money is being spent on through the direct deposit? I can understand the debit card. And then also getting the word out. So if I go to the doctor's office, does the doctor, inform me about it? Because a lot of people are, so unaware of the different things that's out here for them. And then last, if, I know this is for, if you give birth, but just say I adopted a infant, would I qualify for this program?
Great questions. I'll try to remember them all. So the first one is about what do people spend their money on? We get that data from surveys. Every 6 months, all the participants do surveys, and we've had now many of those surveys, and by and large, it is consistent that they report that this is what they spend money on, baby supplies, food, rent, utilities. We do not track any of their purchases. This is all about trust. The second question was about, don't remember.
Getting your word out, doctor's
So yeah, we hardly have to do marketing.
Okay.
We do have materials in doctor's offices and community partners, but the 2 most common ways people find out about the program is word of mouth, friends and family. Every newborn I ask in clinic, I'm like, how did you find out about it? They're like, I got 12 texts when I was pregnant. So word spreads like wildfire in regards to this program, but we do have partnerships with birthing places, but people find out about it. And the last question was about adoption. So the money in pregnancy goes to the pregnant mama, but after the baby's born, it follows the baby. So if there is an adoption or a change of custody or foster care, what have you, it follows the baby. That's how it goes.
Okay. Just a follow-up, a real quick follow-up. When you go to the doctor now, it's a requirement. They ask, do you feel, safe at home? Is this one of the questions that or this information that they give them when they go to the doctor's office?
A lot of our partners, our materials are in the OB offices, and so rack cards and posters and flyers that are throughout. But once again, people find out about it usually from other means, from friends and family, and from social media. Social media is a big one. Representative Rogers, one of our amazing West champions.
Thank you so much for being here, State Rep Julie Rogers, Kalamazoo. I am so excited that you're here spreading the word. Just wondering what kind of bipartisan, you talked about bipartisan at the federal level, but could you talk about a little bit bipartisan at the state level, especially as we're neck deep in budget negotiations?
I would love to. It has been wonderful to talk to legislators from all stripes and realize that everybody loves babies and families and wants what's best for them. So we have had all kinds of support. One of our greatest champions is Republican State Senator John DeMoose, and represents Northern Michigan, the Upper Peninsula. He wrote an opinion piece in the Free Press of why he, as a conservative Republican, supports RxKids. He came with me to the city of Dearborn to meet with Ford Motor Company. He's like, I want to help Dearborn even cut this program. We text. He's my bestie. Literally my bestie right now. So an amazing champion. Senator Hawk in Clare County has been a champion. Representative Coons, also from Clare County. Every legislator that I meet with and talk about this program has by and large been supportive. We will see if that translates to budget negotiations. We also had there was a beautiful opinion piece in the Bridge magazine that came out a couple weeks ago from the Mackinac Center for Public Policy. The Mackinac Center is one of the most conservative think tanks in the state, also saying why they support RxKids, mainly because of its efficiency and dignity. Once again, it is cash transfers. The idea of cash transfers really started from conservative ideologies. President Nixon almost passed a child allowance, the family allowance plan, in his administration. Milton Friedman's book, Capitalism and Freedom, talks about the negative income tax and cash transfers. So this is something that usually has a bipartisan support, and we have seen that support in this work so far. But we will see. So what happens with the budget?
And then I just want to give a little shameless plug. So I agree with you that a lot of people do know about it, but there are still the pockets of people that don't. And I find that they're the people working 3 jobs and stressed out and running from thing to thing to thing. So my office this summer knocked on 9,000 doors to kind of share. We developed a postcard about all kinds of maternal and infant health supports, including RxKids. And the reaction of people that didn't know when we were delivering this news was like, I've never had so much positivity in my legislative career. So kudos to you all. Thank you so much. But it is universally appreciated, and we want to keep seeing it, and I'd love to see it go statewide. So thank you.
Thank you for your support. We would love to see it statewide as well. And so that we do not miss any baby that's born, every baby in an RxKids community gets mailed this packet. So we have data from birth certificates. So we know all the babies that are born in our RxKids community. And so everybody gets mailed this packet. I'm just going to show you this because it's so cool. So they get a personalized welcome card, like welcome to the world, baby Alyssa. We're so happy you're here. Sign up for the program if you haven't. But 92% of people sign up in pregnancy. So this is our last ditch effort to make sure we don't miss anything. There's a beautiful quote from Magic Johnson, who's a big fan. All kids need a little help, a little hope, and somebody who believes in them. We also direct them to other community resources. And then they get these really cute onesies. This one says Bob, how cute is that? And this one says best baby ever. And then my favorite part of this packet is they all get a card from Governor Whitmer. Every baby in Michigan in an RxKids community gets a card from the governor that says, "Dear newest Michigander, welcome to the world. On behalf of all Michiganders, we're so happy you're here. We love you. We can't wait to see what you become." So this is all kind of a deliberate effort to kind of restore trust and faith in government, and that this is evidence of government working for you.
We might have time for one more quick question.
Do you have a lot of epidemiologists or the researchers working on the medical issues and the budget issues so that you can go back to the funding people and say, see how much you've made for this amount of expenditure?
We do. A lot of that data is laid out on page 4 and 5. So we have epidemiologists on our team. We also have health economists who are translating the healthcare savings and child welfare savings into numbers. We have a paper being published this week in the American Journal of Public Health. We have a paper that's about to be published in JAMA, the Journal of American Medical Association, just about our improvements in prenatal care utilization, massive improvements in people going to prenatal care. So we have lots of multidisciplinary scientists who are helping with this from both our anchor institutions.
All right, well, I would first like to thank Alyssa and Dr. Moe for attending, presenting. This is Bill. I'm very happy that we had this chance to talk, even this beautiful sunny day. I really appreciate you guys all coming in here. Arnold, was there more about this next presentation? The next forum is October.
I think you covered it. It'll be October 7th here, and we'll have some speakers to discuss how ARPA funds have been used and what school districts and local governments are doing now that the ARPA funding is wound down. Thank you.
Okay, so we'll have schools and local communities have been impacted by the ARPA wind down, so we'll hear on that. Thank you all once again, and I hope to see you next month. Thank you.